Hello, this is Mary Turpin coming from you live from Universal Family Connections, which is located on the far south side of Chicago, 1350 West 103rd, if you're so inclined. We're there from Monday through Friday from 9 a.m. to 5 p.m. And you're free to come visit us at Ask for Jeffery, Lade, or Mary, and we're free to give you an HIV test and Hep C test. Introduce my coworkers to you.
Good afternoon. My name is Jeffery Jones, and thank you, Mary, for that wonderful introduction. Once again, we are a risk reduction department at Universal Family Connection. We are here once a month, the first Wednesday of the month, to provide you with information and inspiration behind HIV and AIDS. We're here to talk about how it affects our population, especially in the African American community. We're here to talk about how we can treat those folks who have been affected and infected by HIV and AIDS. So today we got a very interesting topic, especially after the awesome election that we had yesterday. Congratulations to the victors and good luck to the person that did not win. And our next person is my coworker.
My name is Lade Ademosu from Universal Family Connection. I'm from the Risk Reduction Department. We address HIV and Hep C testing and outreach programs. We go to communities, events, a lot of places just to provide the awareness. We are open to test you if you are interested. If you have not tested before or it's been a while, you are welcome to come to our office at 1350 West 103rd Street, Chicago. You can ask for Jeffery Jones, Mary Turpin, or myself, or Juliet Jones. We are always available at your service. However, we are always here, like my coworker said, first Wednesday of each month to address different topics relating to HIV, stigma. It could be, mental health. It could be a lot of things that people are suffering from, HIV related. I'm going to pass over to my coworker, Mr. Jones.
Okay, so we just finished with this election. I know a lot of people, they're tired of hearing about the election. They're tired of hearing about the results of the election. I was myself, I was kind of like full with it. It was just like it was too much. You wake up in the morning, they're talking about it, and you go to bed at night, they're talking about it. And so we're really glad it's over with. Yeah. But one of the pieces to this election that I thought was very important that led to our topic today was black men. And, black men really got a bad rap because a lot of folks were saying that the black men would not support a black woman. Black men have been supporting black women, our mothers, daughters, and wives, ever since we landed on these shores so long ago. So we want to make sure that folks understand that black men did support Kamala Harris for the presidency. And so, but today we wanted to talk about breaking the stigma, and we're talking about empowering black men to prioritize their mental health, which I think may have been one of the reasons why many of the black men were challenged in this election between the machismo of our 47th President-elect Donald Trump and a woman, Kamala Harris, that they say they were not familiar with. So we're going to address the stigma. And stigma is feeling a certain way about a certain disease or situation. And so we're going to address that. How do we empower black men? And addressing that stigma of mental health. And we're going to tie it into, my coworkers and I, we're going to tie it into black men and HIV and the stigma that surrounds HIV in black men. If you would just give us an audience. So I'm going to let Mary start out here, and then we're going to flow with that.
Okay, breaking the stigma, empowering black men to prioritize their mental health. This is by Dr. Michelle Leon. She's a clinical psychologist, and a TV host. And she says, strong is not pretending all the time, but there's nothing wrong with you. So you're pretending like there's nothing wrong with you, that's not being strong. You know, it's how black men sometimes do. They don't want to admit that they have a problem. That's not...
Right. They don't want to admit that we have weakness or that we're not strong in every area. And a lot of folks do that, but we're talking about African American men, black men especially.
Black men, yes.
Go ahead, Mary.
Okay, this post was originally published on the Michigan Chronicle by someone named Andrew Ash. They say it can be a silent pain many black men go through, the pain of depression and other life pressures which contribute to mental health issues. Traditional upbringing have taught black men to be strong by wearing their cape of masculinity, often keeping their emotion tapped down tight inside, which may be true. I'm not a black man, but Jeffery, you're a black man. You ever experienced any of these emotions?
Right. So I have a black father. I have a black grandfather. I have black uncles. And yes, it's really difficult to see black men cry and to share emotions, even though I, as an adult now, look back and see that my dad probably had some situations that he may have wanted to cry, but to put on a strong presence to make like, hey, he got it under control. Many men do that. It's not just a black thing, but we're talking about black men today. But I think men are raised to
be tough,
to be strong, to be able to say, I can handle this, I can take this. So,
well, you was told as a child, men don't cry.
Men don't cry, and if we do it around ourselves in the dark, and we don't let people see us do it.
Tough it up, huh?
Exactly.
If you're going through pain.
Exactly.
And that's why we are addressing it today, to encourage people not to mask anything. You know, you are just human being. You are prone to feel. As a black man, you don't have to mask anything. There's help everywhere for especially people suffering, going through depression, you know, relating to what we are talking about.
Yes.
That's why we're addressing it. That there's help. There's always help. You don't have to go through anything by yourself, especially people with HIV or AIDS. You know, there's help. You do not have to suffer alone.
Exactly. And so that's why we're talking here. Finish this one out here, Mary.
Okay. From the COVID pandemic, which has taken a toll on most Americans, to the consequences of stigmatic racism and police brutality, which have taken further toll on the black community. But that's always been the problem in the black community. The police always singing them out, you know, beating them up. And the police just died over the weekend.
Yes, was killed actually.
Yeah. Yeah, he died. But and well, sometime I might say that, you know, maybe the black man didn't have to shoot and kill him, but you know, who knows what he was doing to him. You know.
And so all of this, like we said, this is to empower black men to prioritize their mental health.
Exactly.
It is so important to me as a black man and to us as a social service agency that services African American men in our programs. And we have domestic violence programs, we have partner interview programs, we have
mental health
programs and counseling. And so all of our programs are 95% to African American men and women and families. So this just goes right into the heart of what we do in our mission, fighting for families, fighting for our community. Today we're really focusing more on black men, like I said, because of the stigma that surrounded the election, and how black men were talked about how they did not support Kamala Harris, which was really a media thing. After I polled so many black men, they really wanted to support that the woman who was melanated. So even if she wasn't African American, she was a woman of color. And so we embraced her. She attended a school that was for African Americans and historically black college or university. So we still identify with her and the challenges that she faced. And so black men did embrace her. But when we talk about these mental health issues and the crisis that we might face in being a strong black man, matter of fact, we're here to be the protector and the provider of our families in the face of what we talked about, police brutality, the last hired, the first fired, the one who has to explain it all to the family. So there's a lot that's put on the shoulders of African American men. Even me as a single father, even today I feel it. So it's not something in the past. So this is a conversation that needs to be talked about. But when you add the challenge of HIV and AIDS, then you're addressing something in addition to just the mental health crisis. Mm-hmm. You're addressing the stigma that goes along with it. You might be a fag. You're a sissy. You're somebody that you're sleeping with men. And so they have to embrace that or have to fight against that along with the other issues in terms of being an African American man. So I'm going to talk about that. You ladies got anything to share right now?
Also, they can say that there are more African American men shooting up drugs, and that's the way they can also, contract HIV.
Exactly. And so all of these negative images, especially around HIV, try to make you feel like you did something wrong. But HIV can happen to anybody in spite of your sexual preferences, in spite of your socioeconomic background, in spite of your gender, or in spite of your race. HIV is a killer that is not discriminatory, and it's how it affects people. Stigma surrounding mental health and HIV and AIDS disproportionately affects black men in the United States. I'm going to say that again. Stigma surrounding mental health coupled with HIV and AIDS disproportionately affects black men in the United States. Why, Jeffrey? Because we're looked at as being more promiscuous, just like many of the other sexual diseases that we brought it on ourselves. And this stigma can lead to a lack of access to care, discrimination, negative health outcomes. That's really important. I want to say that again. The stigma can lead to a lack of access to care. Mm-hmm. Access to care is how you get your numbers down to zero. Access to care is how you continue to live. Access to care is make sure that you don't pass the HIV on to somebody else because you're seeking the treatment, and because we know that U equals U, which means undetectable, means untransmittable, means that I can't give it to you if I'm getting the care that I need. But because of the stigma that's surrounding it, I won't even go into a HIV or AIDS clinic. I won't even see my primary care physician because I believe that somebody will see me, find out I have HIV, and then start to judge me. And so it limits the access to care. It brings about discrimination. In terms of what people think about you. They discriminate against you, just the word itself, discrimination, and negative health outcomes. So as I stated, what happens is if you don't get the treatment, Mary, your health outcomes are going to be limited, or matter of fact, they're going to be negative. Because we know that over the 35, almost 40 years that HIV has been a pariah in the American society, so many folks have died not from the disease itself, but just from the stigma that comes along with folks judging you, and you're being afraid to be found out, and so you just die in silence. And so the reason for this program is so that people don't die in silence, that they know that there is treatment available, that they know that there is prevention available, that they know that there's people out here like myself and Mary and Lade and so many African American agencies that are dedicated to making sure that they live long, healthy, and prosperous lives. Another topic talk about is societal expectations. Traditional masculinity norms often discourage black men from seeking help for mental health issues, leading to feelings of shame and isolation. So it's that expectation, Lade, like we just talked about, a traditional masculinity. I must be strong.
Yes.
I can't tell anybody that I'm feeling this way mentally, especially about, like I said, HIV and AIDS.
Yeah.
It's only been recently that we have the LGBT community and the Me Too movement that have came out and talked about HIV, and now people feel more comfortable talking about their status and their pronoun. But before that, you were ostracized for even telling somebody that I might have feelings for another man. Yes. Who do you tell that to? Who do you tell that to?
So what do you tell?
Right, who do you tell it to?
Most of them, nobody gonna stay.
Right,
won't accept it.
Right, they're not gonna accept you as a man, and you know.
Saying you got feeling for another man.
Exactly.
Yeah.
You're going to be ostracized from the community, and now they're gonna look at you funny because you're struggling with this. That creates a mental health crisis. That creates a barrier from real relationships. I can't really tell anybody who I am or how I'm feeling as a strong black man. And that's why we had that phenomenon called the down low. You know what the down low is? What is the down low?
It's people that couldn't identify with their sexuality. They sometimes they deal with women. I'm talking about gay men who are masking their sexuality. They relate to women, but in disguise. You know, they want to be men. They can they want to be men.
Sometimes we don't even know how to talk about it. We can't say the words. We don't want to address it, but real men are having real issues with identifying their own sexuality, and we as a society, we should not put more pressure on them to identify either way, or even announce a pronoun or what's your noun, but just saying, hey, I'm somebody that's I feel a certain way toward the same sex.
Yeah.
But if you're on the down low, you're living a double life.
Exactly.
You're living a double life, almost like being an African American. We live in double lives. Yeah. We don't know if we're African. We don't know if we're American. We can remember our African roots, but we know that we have not been accepted in America. So where do we land? And so that's the challenge of being black in America. Now you're black and gay in America. Who do you talk to about your gayness? And who do you talk to if you're black, gay, and have been diagnosed with HIV? Who do you talk to?
And that's exactly why our agency, we have so many programs that will finesse you into, coming out and, expressing yourself, getting support, to be able to live well mentally, physically, emotionally, because all this affects emotions,
Oh, exactly.
Physical being some people diagnosed with HIV, they stop caring for themselves. Physically, when you see them, you know something is wrong.
Exactly.
And mental capability too.
Exactly.
You are not alone. You are not alone. There's services, there's support groups, there's access to care, there's so many things to give you the support that you need. You don't have to be tough to suffer in silence. You do not have to suffer in silence. This is what our program does. We do outreach, we do support, we provide testing, and a lot of things. So
that's what it's for.
And if you feel that you can't tell your immediate family, what you're going through, maybe we can bring the immediate family there to the office and we'll talk to them together. And you can tell them how you're feeling inside and you was afraid to tell them. We'll have counselors there at our work site.
Exactly. See, and that's so important. That's why this topic is so important, because we have those resources available. And not only that, on Fridays from 10 a.m. in the morning or even earlier, we have a support group for folks who are HIV positive, who have been diagnosed with AIDS. There's a non-judgment zone. We're there to share with each other, to support each other, to address any mental health issues or even medical issues that you might be facing. So it's so important. And we take this very serious. This is not a light thing. We're not just on here to talk about subjects, but we're here to say that we are available. We're at 1350 West 103rd Street. Our phone number, take our phone number down, 773-881-1711. Again, call me, Jeffery Jones, Mary Lade, Lade Ademosu, and Mary Turpin. We're all there. Call us, 773-881-1711. You can also visit us at our website. Our website is www.ufcinc.org. Send us a text. Visit us on our website. Call us. We are available. We'll talk with you. We'll give you resources. And everything we do is strictly confidential. If you don't know if you're HIV positive and you think you might have had interactions with somebody the previous night, come on down. You don't have to have an appointment. Just show up. 9 o'clock. Just come in. We will test you. You'll get your results in 15 minutes or less. It's confidential. We don't share it with anybody. We're going to give you some great counseling. We're going to be a follow-up agency. You can call us even after you've experienced the testing and you came back positive, you came back negative. We are there for you. This is so important that you know the Universal Family Connection. We've been around for 48 years doing services in our community. We have over 15 programs that include housing, youth for housing. Even though we don't have our own housing agencies, we do referrals. We have a work program. We have also a DCFS program, Intact Home Relatives. We have a full spectrum of programs. Call us up. Ask what we do. I promise you, if we can't do it, the one thing that we do very well is that we will refer you to the resource wherever it is in the city that you need to address your issue. Please give us a call, 773-881-1711. And that's Mary, Lade, and Jeffery Jones. Also, we have all those different programs. But we don't want to leave before we continue a little bit more about African American men, black men, in this issue of surrounding HIV and stigma and the mental health crisis that comes with it. That doesn't mean that you've been diagnosed with a mental health issue like depression or schizophrenia or any of those things. That just means that it's challenging you in your life to move forward or to expand where you are in your life. And so you might need somebody just to walk it out with you. You might just need somebody to talk to. That's what we're here for. You have somebody that will listen to you and understand what you're going through or what you've been through, because we've been doing this for quite a while now. I've been doing HIV testing, counseling, outreach, and care and case management for over 20 years. So you get somebody that understands and have talked to a lot of different clients. We're going to close it up. Go ahead, wrap it up, Lade and Mary.
Okay. As a black man, you've been taught to be strong, brush it off. But I notice more black men are starting to seek treatment, which is good.
Yes. You do not have to endure it alone. Like I said earlier, you have people to talk to. you can open up, you will get support. You do not have to suffer alone. Mentally, emotionally, physically, we are here to support you. We're here to address any concerns you have.
Thank you for tuning in. We'll be back in December, the first Wednesday. We're here every first Wednesday of the month. Come on back and visit us. If you got questions, you know you can call us 773-881-1711.
Tell them the location. Please.
Thank you. 1350 West 103rd Street. You can come and visit us. We're in the Beverly area in Chicago. Thank you so much.
Thank you.
Enjoy the